Hi everyone, welcome back to the In 2 Minutes or Less Sideline Review series. Long spine boards have long been the standard to immobilize critically injured athletes. However, changes in EMS protocols, which are tending to favor spinal motion restriction over immobilization, have changed their approach to use of the long spine board, and in some cases, taking the long spine board off the rigs altogether. Today, we're going to do a deep dive into a hybrid system that is becoming a standard for elite sideline medical teams. This is the Hartwell Medical CombiCarrier II. Today, we're going to break down the functionality of this device in the unique athletic environment. The CombiCarrier II is a two-in-one tool, functioning both as a long spine board and a scoop stretcher. Its polyethylene shell, urethane foam core, and molded design make it buoyant for water rescue, easy to clean, and it's X-ray lucent. But before we get more into its functionality, let's talk about specifications. It's a little more than 6 feet tall, about 16.5 inches across, and a little more than 2 inches thick. A key component is it has a 450-pound load capacity. That's more than enough to handle your average offensive lineman or even your biggest sumo wrestler. I really like the design of the 14 oversized handles and the speed clip pins that are integrated into those handles. This, I feel, ensures your restraint system is physically part of the board's structure. The latches on the CombiCarrier II are well designed and engineered. These latches are strong, easy to use, and flush with the unit, so they won't pinch your fingers or the athlete, won't catch on athletic equipment, clothes, or hair, and they certainly won't release unexpectedly. Now, the current trend in EMS is to remove long spine boards from their ambulances altogether. But oftentimes, these EMS providers will still carry a scoop stretcher. And the scoop stretcher certainly offers a lot of advantages when we're trying to reposition and transfer our critically injured athletes. But as an athletic trainer, I can recall multiple times when a long spine board was the better option for transferring a particular athlete. And that's where the benefit of the CombiCarrier really comes in. It's a 2-for-1, a 2-in-1 tool that allows both for the features of a long spine board as well as a scoop stretcher. When the scenario calls for transfer to rigid support, the CombiCarrier II can act just like a traditional long spine board. The 6-person transfer lift is a common patient transfer approach used in sports medicine because it is shown to minimize segmental rotation by keeping the athlete on a level plane. When we used the 6-person lift approach, we came to appreciate the universal design of the CombiCarrier II, meaning that there is no designated head or foot end, so we didn't have to worry as much about proper board placement. A seemingly small detail, but in an emergency, the little things matter just a little bit more. A log roll maneuver is another common technique for placing an injured athlete on rigid support. We felt the curved design feature of the CombiCarrier II offered some benefit over traditional backboards. When we placed our patient on the CombiCarrier II using a log roll maneuver, we felt the curved handle design made it easier to position the device for a more efficient log roll. We also felt the curved design made it easier to grip the handles and lift the patient without pinching our fingers. When we secured our standardized patient to the CombiCarrier II, they reported they felt we had achieved a high level of spinal immobilization. The CombiCarrier II can also serve as a scoop stretcher. Remember, the 2-for-1. We looked at 2 techniques for scooping our patients using the CombiCarrier II. The first technique we used was to split the unit into 2 complete halves. The second technique we used was a scissor-type technique. Like with all other scoop stretchers, we did have to work the halves under the patient a bit to get the patient properly positioned. But we all agreed the ease of use of the latches resulted in less movement overall, compared with other scoops we have worked with. Many of the other scoop stretchers we have worked with here in the SMC Sim Lab have flimsy frame construction that just simply cannot accommodate larger athletes. And they also have clunky latch designs that make them difficult to separate and re-engage. Now, regardless of the technique or approach we use to position our athlete on the CombiCarrier II, we all felt very confident that we had secured our athlete to a single rigid piece that would not sag under the weight of even our largest athletes. Now, you'll recall the urethane foam core is X-ray translucent. This could be a significant benefit for those that have protocols that may allow for a quick first look in in-house radiology before packaging and transporting into the ambulance and transferring to the emergency room. Now, at 6'7", I'm not necessarily going to fit on the CombiCarrier that runs just a little over 6 feet. But since I'm only 5'9", I'm going to fit on this thing all day long. But the average NBA player is 6'7", and we certainly have a lot of other athletes that are quite taller than 6 feet as well. In those cases, their feet or legs may hang off the CombiCarrier. Okay, here's a pro tip from the Sports Medicine Concepts crew. In the event that you have a taller athlete with a lower extremity injury, make sure that your athlete's head and thorax are supported on the CombiCarrier II. Next, apply an appropriate immobilization device to the lower extremity. It just so happens, here at the SMC SimLab, we use the Hartwell Medical Fast Splint. Once your immobilization device is properly applied, you can have an additional rescuer come in and support that lower extremity while the rest of the medical team carefully lifts the CombiCarrier II with the athlete and transfers them to the EMS gurney. More and more spinal motion restriction guidelines emphasize minimizing time on the board. So many protocols now call for removing the board once the athlete is on a padded EMS gurney. With a standard board, removal requires another log roll or lift slide maneuver. This typically takes place at the side of an ambulance before the athlete is loaded for transport. Long spine boards often have rails on the underside to allow rescuers to grip the board. But these rails make sliding the board out more challenging because they often catch on the gurney sheet or can dig into the gurney padding. The CombiCarrier II's curved design and smooth undersurface allowed us to grip the board and easily slide the device from under the athlete.
Remove the straps.
Because the CombiCarrier II splits, it offers the added benefit of simply unlatching the ends to slide the halves out. The athlete remains supine and centered on the gurney mattress with minimal spinal manipulation. It's the cleanest exit strategy in the game. On the off chance that the athlete is in the ambulance when the need to remove them from rigid support arises, the process is challenged by tight quarters in the back of an ambulance. But our team felt the ability to unlatch the sides and pull the halves apart provided better patient handling than performing a log roll in the back of an ambulance to remove the spine board. So before you take the CombiCarrier out to the sideline, there's a couple of best practice things that we suggest that you do. First, double check these clips on the back here, the latches. Very well designed. Just make sure that there isn't any debris caught in there, grass, turf, tape, anything like that that could affect the crisp design of these latches, okay? Second of all, make sure the CombiCarrier is clean. And if there is any debris or dirt or anything like that on the surface, a standard clinic cleaner can be more than adequate to clean that board up for you. Double check the integrated pin systems to make sure the pins aren't cracked or that there's dirt or anything in the area where you might be gripping the board. And then check the integrated pin latches, okay? Make sure that they're set up exactly the way that you want and that they're latched effectively. The nice thing about these is they're very easy to take on and off. So if you do get yourself in a situation on the sideline or out on the field where these are turned the wrong way, very easy to unhook and just spin those clips around and hook them back onto the integrated pin, okay? A quick tip or a trick that I like that many EMS providers use is I like to take these straps and roll them up, place a rubber band around them, and then tuck them right into the handle area. And that keeps all four of my straps secured to the board but out of the way so that they don't get tangled up when we actually deploy the board from our field cart, okay? All right, so now we have our pre-check done, and we're ready to load our cart with the CombiCarrier on it. Now, be a little bit aware or conscious of how much weight you put on the board. It's more than strong enough to carry all of our ALS and BLS equipment that we'll need on the sideline, but maybe be aware of maybe some heavier items like larger oxygen tanks, or maybe just the combined weight of a lot of different things. But in the sideline environment that we're practicing in, very rarely are we going to have equipment that stacks up too much on the combi carrier. So now we're all good to go. We're loading up our BLS and ALS equipment here on our sideline cart, and we are ready to roll. Now take a minute to think about where you're going to rest your field cart, where you're going to station your field cart. The CombiCarrier is more than durable enough to withstand the temperatures or the heat that might be involved in a hot, sunny sideline, right? So there's no problem with the structure itself of the CombiCarrier, but remember, if this is in a direct sunlight, the board itself could get pretty hot. And that might be uncomfortable when it comes time to grip for our rescuers to grip the CombiCarrier or to place an injured athlete on the CombiCarrier when it's really, really hot. So be conscientious of keeping all of this stuff out of the direct sunlight. And that's a best practice approach anyway for all of our EMS equipment. We don't want this in direct sunlight. Okay? So now we're ready to roll our field cart out onto the sideline. The Hartwell Medical CombiCarrier II is a seamless design that integrates both the features of a long spine board and those of a scoop stretcher. This facilitates our ability to immobilize an injured athlete and safely transport them out of the chaotic athletic environment and into a more controlled environment to improve the care we provide. All SMC staff that participated in this review agreed the CombiCarrier II offers significant benefits over a single backboard and a single scoop stretcher, offering that 2-for-1 tool, if you will. In fact, one of our SMC staff members has outfitted every single ambulance in their agency with the CombiCarrier II. If your sideline equipment and emergency action plan is due for an upgrade, I strongly encourage you to look at the Hartwell Medical CombiCarrier II. So let me know, what's your preference for immobilization? Drop it in the comments below. I'd love to hear from you. A special thank you to Hartwell Medical for the confidence they have in sports medicine concepts and for sending us the CombiCarrier II for this sideline review. Now go out and prepare to respond flawlessly, and we'll see you next time on the next In 2 Minutes or Less sideline review. Thanks for watching.